Happy Sunday and welcome to Let's Talk About You. I am your host, Camilla Francis, and it's always an honor and privilege to be here with you. Happy Thanksgiving week. We all have so much to be thankful for. We have made it another day, another year. Oh, we just have to give God all the honor, glory, and praise because we are here. And this Sunday, we're continuing our conversation about Movember, Men's Health Awareness Month. And last time we had such a phenomenal conversation with Dr. Gilbert Commission and Renix Charles talking about his testimony and his journey of where he had come from with not taking care of himself, paying attention to the signs and playing comeback. So he is now healthy, stable, moving forward, doing what he needs to do. And that in itself is a testimony. I hope that everyone shared that last footage so your loved one can know the importance about taking care of their health. We're continuing this Sunday with Dr. Sheener Walker. She's a licensed clinical psychologist of mind, body, and psychology. It is just such an honor. And in addition to talking about our bodies, well, our men's bodies, we're going to talk about their mental health. Dr. Walker, welcome to Let's Talk About You. Tell us more about yourself.
First of all, thank you so much for having me. It really, really is an honor, especially to talk about such a relevant topic and one that's really near and dear to my heart. So for your listening audience, good day. My name is Sheena Walker. As Camilla stated, I am a licensed psychologist, and I'm also an assistant professor of psychology at the University of Virgin Islands in the psychology department. So I'm the owner and in private practice here, again, in mind, body, health, and psychology, where I provide treatment to individuals, couples, families, men and women. I'm really interested to talk about and unpack this topic today.
Thank you so much for joining us. Thank you for saying yes. When I did some research, I noticed that men, the rate for suicide and depression are even higher than women. And that was really surprising to me because, men are the bravado. They seem, because I have to say seem based on my research, to handle things so well. So that was really surprising to me. And I figured we need to talk about our men's mental health. We need our men to be whole, not just physically, but emotionally and mentally.
Absolutely,
Can you
absolutely.
shed
So
some insight on that?
sure, you were just mentioning the suicide rate being um, exponentially higher than women's. In fact, it's 3.5 times higher than women, and men are more likely to die by suicide attempts than women. And so, beyond that, though, the life expectancy, even for men, is much shorter than women. And I could speculate that much of that is to what you were mentioning. There's a lot of expectations that we as women, that we as a society, that we as community put on our men. So it really, really is time that we start to talk about, further our studies about, and just really attend to our men.
So, as a psychologist,
Mhm.
what tips or things that our men can, or what can we do to assist to guide our men? It's okay to talk to somebody, because I know that we put the stigma: you're brave, you're brazen, you're the provider,
Mhm.
you're the nurturer, and because you're the one that's supposed to take care of, you're good. And
Right.
men tend to not complain, and they tend to let things, I guess, go over their head. But I guess that means they're truly internalizing and not releasing.
Absolutely. And so I guess my first response to that is that we really need to ask ourselves, what is it that we are promoting within our own lives and our own, what are we communicating? Right. And so just like you were saying, there's these expectations for men to keep it all together, to be stoic, right? To not show any emotion, to not give any support or affection, showing any kind of affection towards their fellow man. And again, what I've seen, unfortunately, in my research is that that really creates a good amount of psychological strain because of exactly what you were saying. Men internalize these messages that we are either communicating in our day-to-day language, and believe that the best way to carry this is to just carry it on my own. In fact, that's the furthest thing from the truth. One of the things that I like to promote is what I was just saying, sort of going against the grain and encouraging men to support men. I understand because of my father and being able to tag along with him growing up as a little girl, that a lot of therapy is happening in the barbershops, and a lot of
Yeah.
therapy is happening on the basketball courts. It's just we need to also sort of change the way in which we're looking at it as well. So we need to, one, take a look at what it is that we're communicating to our men, and then openly encourage them to talk to you, talk to their friends, and support one another.
I did see that's where the new therapy is, in the barber
Hmm.
shop and the
Yes.
basketball court. So at least they're getting the some of the stress out. But
Hmm.
in addition to that, more needs to be done. Is it that we as women, I'm going to put us out there, do we need
Hmm.
to talk less? Do we need to give them a chance to at least respond? Because I know when we're in, at least when I'm on a tangent, I forget there's something, someone else in the room, and I can just go for it.
Yeah, I mean, and this is really interesting because it's tangentially related, but still can impact the way in which men function. So I talk about this all the time when I'm working with couples. Men are so, and this is a vast generalization, but for the most part, is true. Men are very solution focused. And so oftentimes, when we are just sort of what I call just spewing venom, sometimes even just getting out some of the toxicities of our day, what they're doing is catching it, catching all of that venom, and then trying to find solutions to it. And sometimes it's overwhelming. And the interesting thing is as women, sometimes all we want them to do, and so this is my message to the men out there, is sometimes we just want you to hold what it is that we're saying, and just to say, we're hearing you. And so we really ought to look at how we're communicating with each other, just again, like I said before, on a day-to-day basis. Yeah, so I'm glad you brought that up.
How do we get our men to be open up some more? Because a lot of times they don't open up. And we
Right.
know we said there's the barbershop talk. We said that there is the basketball talk.
Hmm.
And when we're spewing and we what we want, how can we truly show them with, I guess, our emotions, or tone it down, or what can we do, even we are how we are,
Hmm.
assist them to open up?
Yeah. Well, one thing is we can just outright say, it's okay to leave here and seek help. It's okay to talk to someone else, even if it's a professional. I like to tell people that coming to a therapist is much like talking to a friend that can hold water. Not to say that your friends can't, right? But that's sort of the dynamic that of what it feels like to be in therapy. So if we can just sort of outright encourage um, men to talk, even if it's not with us, to someone else outside, that might be of service. Another thing that I want to say um, is that perhaps there are um, taboos that are still attached to mental health and that are attached to, especially with men. But you would be surprised of how many men that I do see. I feel really privileged and honored to be able to say, like, maybe 35% of my population that I see are men. And I think the best sort of way for men to sort of again receive some of that support is to talk. So one of the things that makes me the happiest, of course I can't sort of encourage other people by saying so and so sees me and you can come and see me as well, but it's
Right.
the best feeling when I know a gentleman comes back to me in session and says, I shared with so and so that I come into therapy, and I encourage them to do the same. And so we're starting to see a shift, especially given what we've all endured through this pandemic. And thankfully, we're all talking about it. It's sort of the golden age now again of mental health. thankfully.
Well,
So
that is good, and that's good to know, especially in this close-knit community that,
hmm
and we're so small that
hmm
men are coming to you, and you do have that clientele. So that makes me happy. And in
yeah.
addition to you, um, see having patients and being a professor, I know you're doing your own research with regards to men and mental health. Can you tell us some more about that?
Sure, sure. So it's again, this is why I'm so excited to talk about this topic because it is absolutely wrapped up in what it is that I'm researching. So prior to my coming here, I did a lot of research with African American men and gender role conflict. And what that means is exactly what we're talking about. What do or how do men react to some of these responses that we're communicating in hegemonic society? Um, and even beyond that, what is it that they're receiving in social media, in the movies? And what it is that again the same topics and the same narratives that we've been talking about. Men are to be dominant. Men are to be stoic and without, you know, communicating their emotions or their feelings. But it's only natural and normal for us to do that, and that's why again I expected and anticipated seeing some of that within the sample populations that I researched. Unfortunately, what I did see was true. Unfortunately, 65% of my population that I researched talked about having some issues with either dealing with anxiety or somatization, which is feeling stress within your body. Which I think is was very interesting and made a lot of sense. Again, if we're not expecting men to speak about their feelings, it's gonna come out somehow. And for a lot of people, and especially within again people of color, it usually comes out through ailments, heart disease, high blood pressure. All of that is also tied in with this psychological strain. And so another thing that I talked about in my research is I'm a Fiskite and a big fan of W.E.B. Du Bois, who is actually a sociologist. And he spoke of double consciousness or existing as a cultural minority in sort of this white world and having to navigate at least two parts of yourself. So I've recently been looking at that dynamic to see if that also plays into psychological distress, as you could imagine, not feeling confident to integrate all parts of yourselves and to show up into the world in that way can be very impactful over time. So interestingly enough, I did that research recently with the Caribbean um, population of men. And sure enough, there are hegemonic society, standards rather, that the population that I research feels like they have to adhere to. So really what I take with all of what I'm finding in my research is that we need to communicate to our young boys even before they become men, right? That it's okay for them to um,
Have emotions.
absolutely, and increase their emotional intelligence. Emotional intelligence is just having an understanding of what your feelings are, being able to recognize them, and then to make decisions from that. Emotions
Yes.
are not a weak thing at all, right? So if we
Yes.
can communicate that from young and then encourage them to be who they are, um, they'll grow into healthy, psychologically minded men that can be the pillars of our community that we're sort of demanding them to be now. So that's what my research is about. Thank you for asking.
Well, and that's great because even if we go back a little bit to the beginning of what you said, you talked about the cycle or the chain of events by holding things in, not communicating, not talking about it. It can alter your health and things begin to decline and it cause other things, hypertension and all these other things that impact your body.
That's right. That's right. And that's
So
why I always like to encourage people to, you know, learn more about the mind body connection because again, how we feed our minds, how we feed our bodies all play into our overall health and wellness. Yeah.
and I love and also the talk about our young boys because I'm always saying it starts with now when they're young, because
Right.
too many, see, I'm an advocate about women's conferences talking about women. I speak at them, I go to them, I
Hmm.
enjoy participating and passing knowledge and empowerment and encouragement to our adults. But one thing that is a fact, if we start with our children when they're younger, we will have less conferences, but we will know that we're building a society of whole individuals, and
Right.
that is important. And just the name of your company, Mind Body Psychology, let's just
Right.
pause for that in itself. Just think about that. Your mind, your body, your psychology, that is
Right.
important. That is profound in itself. So you mentioned um hegemonic. Am I saying it correctly?
Sure. Yeah, hegemonic society. What I
Yes.
mean by that is, what are the messages that we're receiving just as a people? So, for example, as Black women, what hegemonic society says about us are that we are strong, which is true, but that we also have emotions that we sort of put on the back burner. That even in health, they say that we're more tolerant to pain than our other counterparts, which is not necessarily based in science. These are the false narratives that inform us in our daily lives and impact us about what we tell ourselves, and that's really um, what we should pay attention to. We listen a lot to what again what we feel like we should be. And the truth is we need to just be ourselves and children of God at first and
Well,
foremost.
sometimes we don't even know what that is or what
Right.
that means because,
Right.
like we said, you're supposed to be we brave, we're good, but you're supposed to be heroic and not afraid, and you're supposed to take care of, and you're supposed to be the provider, and you're supposed to man up.
That's
You're
right.
supposed to not be a
That's
because
right.
you know.
And there's so many words, yeah, that we can fill into complete that
Yeah,
as
so
well.
many things that we can fill in the blanks. And
Right.
all of that is, I think, is just chipping away of an individual that one may not really know who they are
Right.
because they weren't taught, they weren't given the opportunity to try to find themselves, and they're
Right.
trying to play catch up. So in that
Right.
race of playing catch up, help them, help us.
Right. And and I'm a big fan. I grew up listening to a lot of hip hop music, and a lot of, R&B and all of that, right? And thankfully, there's some really good narratives out there that are within hip hop, but unfortunately, much of the masses of what we hear um, are not glorifying, the self, are not uplifting women or men. And what it's teaching is that yes, power and success can be reached, but sort of in the wrong avenues and in the wrong ways, right? So another way that we can help our men are by letting them know that there's various avenues of success. Success doesn't just have to be wearing a lot of jewelry, having a lot of what we would see as money and opportunity. Those are those ideals again that hegemonic society
Okay,
are pushing forward.
I
That's not
got you.
necessarily the truth, right?
And not only that, I'm glad you mentioned that with, the hip hop society, or just any society that glorifies fame by tearing one another down, because they're
Right.
tearing themselves down, they're tearing women down, they're
Right.
tearing their clothes off because they're not even dressing.
That's
They
right.
just figure showing their boxers is a good thing, and it's not. And
Right.
we definitely need to take the taboo off of mental health and mental awareness, because when we're trying to find that guy, or when you see that individual, we want to know that they're a whole person and not just fine.
Right.
You need them to
Exactly.
be fine and not just fine.
That's fine, right? That's such a great point. No, I tell my children and I tell my students all the time that you have to first love yourself before you could love anyone, right? And so hopefully, yes, whoever it is that you are also looking at, if you're dating them, right, you can see that they love themselves first. And if not, then advise them or encourage them to find that self-love. Because, like you said, a lot of us get lost. A lot of people are getting lost because they don't know who they are. So.
I know that you can't talk about your clientele in details, but
Hmm.
some pointers with a person that has issues or trust issues. What do those things tend to come from when it deals with men?
So, trust, and really, it's much of the same is for women.
Okay.
So a lot of what how we become or who we become usually reflects a lot of the early days of our lives, and how we sort of related with those people around us that were raising us at that time. So, um, unfortunately, if there's trust issues in your romantic relationship, chances are there may have been trust issues from your family of origin, from where you come from. So, if there's a way that you can revisit some of those past hurts or past traumas that played into that mistrust, that will really help to reflect your trust within your romantic relationships. I know a lot of times people don't like to think that, when you're going into an interpersonal or a dating relationship, that you're informed by your relationship with your parents, but that at least that's my opinion. That's what I see time and time over. So your relationship with your parents absolutely affects you into your adulthood.
I agree 1,000%. And I think that's,
Hmm.
I mean, I don't want to bring up the fact that because infidelity is so much so because it goes both ways as well.
Right,
But I think a lot of it has to do with the trust, the lack thereof, or trauma, just
right,
trauma.
right. Exactly. And a lot of times when there's trauma, it begets more trauma. So trauma compounding more and trauma, usually it's a snowball effect, and can become very overwhelming to address, once one becomes an adult. So it can feel a little daunting, if you might have someone out there that's listening who might feel like, that resonates with me. But how do I go about it? Well, taking the first step by just saying, you know what, I need help. And then allow the professional, if you're coming out to seeing a pastor, or if you're coming to see a counselor, allow them to help do the rest, right? And trust the process, even though it's easier said than done. So, yeah.
True, and I'm glad that you brought up the point of pastor because I was going to say that as well. A lot of times we say, "Oh, just pray about it." But
Mm-hmm.
just talk to your pastor. You don't need to talk to anyone. Talk to Jesus.
Right.
That's
Right.
gonna help you. But
Yeah.
I think Jesus is telling you it's okay to talk to someone else because I'm
Right.
listening anyway. You
Right.
know,
Right.
and we need to get out of that small mindset and boxing ourselves into shame. Why?
Right.
Why is there shame?
Yeah. And I'm thinking a lot of times there's shame because people just don't know. So that's why I like to talk about, like, what does therapy feel like? What does it look like? Well, right now I'm sitting in my office, right? So it much looks like any other room that you would expect. So what is it like when you come in to speak to a psychologist? It's pretty much like what we're doing right now, just having a conversation, right? So I think there's a lot of um, ambiguity surrounding, like, reaching out and getting help, but another thing that I like to say within therapy, it's not me or any other professional that's going to give you advice. In fact, that's what we do not do. What we do is basically just hold up a mirror and allow you to process your thoughts and your feelings, so that at the end of the session, but you'll have steps to go and move forward from there. It's not me telling you what to do, or any of those types of things. And so there really ought to be no shame. Yeah, and getting help and talking with
And that's
someone.
good to know. You outlining the steps so our listening audience can know if I'm
Hmm.
afraid or I thought about it or maybe, but you're right.
Hmm.
You aren't telling them. You're holding up the mirror so we can see who we are and what needs to be fixed, what needs to be addressed, and
Right,
steps to address whatever.
right, exactly. And another thing that it does is it really gives you time to practice self-care. It gives you time to really reflect on, what is it that I feel in this moment? What is it that what are my goals from this moment? And how would I like to learn and move forward in this moment? And so oftentimes we don't give our, each other or ourselves rather, that time to just process and to reflect. So I encourage everyone to do it, but
I
especially
agree.
men.
And when you mentioned self-care, I was just relaxed when you said that because we don't realize dealing with our mind, our mental state helps in our every second. I can't even say every minute, just our every second agenda of the day. You know,
Right,
when we're combing our hair, when we get out of bed, we have to focus on that self-care and our mind can take us from 0 to 1,000 in a second.
right, absolutely.
So,
I-
can you expound about, yes, as you said, it's self-care. Why is it self-care? If I don't have an issue, why would I come? I'm good. I don't have any such childhood trauma. I have a great job. I'm making it. I take care of my kids. I'm the man of the hour. Why?
Right,
Why would I
right.
come?
Right. And so all of those are things that I've heard before, right? And what I will say is that it could still definitely help you to learn and grow, and move forward towards your either personal or professional goals. Another thing too is that although you might not have any childhood trauma, although you might be, have it going on, you're also a human being that's living through right now, unfortunately, hopefully the tail end of a global pandemic. You're also a person that has probably um, had to be exposed to a lot of the information out there regarding our political instability, with our host country. I was going to say because we can't vote, but anywho, um, right? I mean, and there's a lot of frustrations with just being a human being.
Yes.
Um, and so we all really do need to have that self care. We're giving ourselves at least 8 hours a day, right? To either an organization or some sort of company or some other uh, goal, that we may or may not have created. And so, at least giving yourself 30 minutes. For some people, I encourage them even to start with just 3 minutes a day, of just self care that really can um, set a new trend and set a new standard for yourself.
And what would that
Um,
3 minutes entail?
So I like to tell people just deep breathing. You would be surprised, especially when you're waking up in the morning and like you were mentioning, like getting yourself ready for the day and hustling and bustling. Oftentimes, what happens is our mind goes on automatic pilot. Sometimes, right, you'll be in automatic pilot all the way up until you arrive to your destination for that day. So one thing I like to encourage is deep breathing. I call it the 6, 7, 8s, where you breathe in through your nose for a count of 6, hold it for a count of 7, and breathe out through your mouth like you're breathing through a straw for a count of 8. I guarantee you, if you do this for 3 rounds, you'll feel just a little bit more settled and a little bit more centered. So, spending 3 minutes doing that can really help you to find your center, like I was saying, and find your balance so that you can be the best you going forward.
It works. It works. And I know
Yeah.
that I was on the my thing, my exercise rule, which I now learn my 10 minutes a day was not working. I needed to
Okay.
put in more, like 30 minutes or more. But in addition to that,
Hmm.
adding that 3 minutes to your whatever day, and you could do it driving, correct? You could
Absolutely.
do that
Right.
3 minutes when you're driving, so it doesn't take away. You don't have to make a special time to do it. You could be drinking,
Right.
making your coffee,
Right.
your breakfast, taking a
Right.
shower, and I think the shower is the best place to do it as the water runs on you. You know, you're doing
Right.
that deep breathing. You're not only cleansing your body, but you're cleansing your mind. So I like to do
Right.
mine in the shower.
So do I. That's actually my favorite place to start my day with prayer, right? It's an intimate place and it's a great place, like you said, to cleanse. So you're
Yes.
right. Yeah. Um,
But I
so
totally agree with you there. And in addition to your research, how long have you been, what's the end goal for your research? What is it in addition to?
yeah. So the end goal is for me to be able to better find my craft, right? So I want to be able to reach more men, especially Black men, and get them within, the therapeutic room, so that they can find their own healing. Because I really do believe, in the traditional sense. that men are a major part of our family. In fact, the heads of our households, right? And
Yes.
I believe that if we can provide them the love and support to provide themselves the healing, well, then they'll be able to also provide the, the sort of an example, right, as the head of households, as being psychologically minded and being um, able to balance oneself, emotionally, spiritually, physically, mentally, all of those things. And so um, the end goal is really to just to better support our black men. How can I better support what it is in their livelihoods? Because really, I got into this research because I have three sons. One of them is a an adult, now, and I've always recognized how difficult it is out there to be a black man, and so I wanted
Yes.
to delve a little bit deeper. But eventually, I would like to try to make it a little bit easier for them, and safer. Really, as a mother, that's my biggest fear. Is I want my children to be safe. So hopefully, this is what my research can do.
Well, I think that you got something huge, and I think that it's definitely great. And I'm glad
Thank
that
you.
we're having this conversation because I don't think anyone is talking about it. I think that we
Yeah.
just maybe mention one or two things. Like you said, everyone's talking about the pandemic, so that's encouraging people to talk, but we're not
Hmm.
really talking about that we need to take care of our men because we
We
need our
absolutely
men for
do.
more ways than one. We have to
Right.
take care of them. And as a woman, I know that I don't want to say we always have things for women because I know that we too need that. But I
Hmm.
think that there are times that we just need to just give the men the honor that they deserve and give them the time that they need. And let's talk about them, celebrate them, help them find them so they could be
Right.
better to us.
Right. Exactly. And there's nothing wrong, right, with the feminist movement
No,
and all of
no,
that, but it really has sort of overshadowed some of the works that has been done with men and for men. So again, this is why I'm so glad that you're bringing this up because it's not talked about enough. We There was a little bit of buzz maybe about 10 years ago in talking about toxic masculinity, but unfortunately it was just sort of a buzzword, and then and it went away, right, with the next trend coming about. And so yes, I'm glad that we're talking about the need for men to be men, but also to be supported so that they can experience some healing for themselves because
true,
they endure many traumas that are compounded upon traumas. So again, if we could support them,
true.
it could help us as a community. Yeah.
Absolutely. Can we talk a little bit more about the toxic masculinity?
Sure. So the toxic masculinity really comes out of some of the work also that informs my research, where it talks about there is an ultimate fear of of being feminine as it relates to masculinity, and so this is why we hear men being called X, Y, and Z, right? When they are um, communicating feelings. This is why there homophobia exists, right? Because it's a little bit too confusing regarding the femininity. It sort of bleeds a little bit more into that, and so there's this source of again fear of men crossing over into femininity, but it usually plays out in these behaviors again that restrict men from being able to speak. And so it's really sort of like the source of the messaging that I was mentioning earlier from hegemonic society. So if we can teach men to again not necessarily look at it in terms of femininity versus masculinity in black and white terms and allow them to just embrace the gray. We all have, these feelings of positivity and negativity. It has nothing to do necessarily with femininity or masculinity, right? But unfortunately, it's been tied to that historically. So if we can release those concepts of toxic masculinity, we can promote again men just being emotionally intelligent and allowing to really label what it is that they're feeling so that they can again use it appropriately.
Okay.
Yeah.
Does this is this also where the term metrosexual comes in, where the men can do things that, get the manicure, pedicure, do certain things, but still keep their masculinity. Is that where that comes in?
Right. It's sort of tangentially related to that. Yes. And if you also recall, in the 1990s, also there was a lot of talk about like down low movements and things related to that. All of that is related to toxic masculinity. Yes. So metrosexualism is sort of like a way to embrace the gray, right? But that's I would like to stray less, stray away from that because it's not necessarily sexuality that I'm talking about. It's
Right,
more
right.
of the ways in which we're communicating our feelings and emotions. Yeah,
Okay. Okay.
yeah.
Yeah, well, that's good to know. And
Hmm.
also, the fact that you have three men, and how do you have some of those hard conversations, because as you said, you want them to be safe, and we
Right.
safe too. How do you go about having that hard conversation with your adult son and with your younger kids, sons?
Right. So it's unfortunate, but what I believe is still to be necessary that one, maybe not so unfortunate that I've taught my kids from very young how to communicate their feelings. I teach them how to identify, or what I tell my psychology students how I teach them how to metabolize their feelings, which is identify what the feeling is, and so that you can understand, where the thought process might be coming from, and so again to make an informed decision moving forward. I start very, very young with my children talking about that. But it's because we're people of color, even though we live in the Caribbean where it's a bit more safe regarding, some of our political and social environment, I still talk to them about race and how they might be perceived into the world. That is unfortunately a part of as a mother at least, my responsibility to keep them informed so that they know exactly how to respond, or so that they know how others might be viewing them so that they can respond appropriately. Now, I don't teach my children necessarily to cower or bow down to anyone, but it's more of teaching them how to articulate themselves. Um, so that if in the event they're in any sort of sticky situation, whether it be home or away, they'll at least know how to communicate themselves, intelligibly. Now, I still have an understanding, though, that there's still outside factors that could influence in whatever exchange that might happen. But that's something that I feel like is important. Just being as realistic with my children as possible, so that when they become adults, it's not a shock. There's no, um, you know, again, just shock, like I was just
Yeah.
stating. They're prepared. It's sad, but it's our
It's sad,
reality.
it's true, but that's excellent, and that's great because now you've given pointers to our listening audience on how to have those conversations with their kids,
Hmm.
when they're put in certain situations. And yes, we are semi-sheltered being in the Caribbean, but we
Hmm.
need to be aware because we travel, we go abroad, and things may
Right.
escalate even within your home setting. So.
That's right.
Thank
That's
you.
right.
Thank you for giving
Yeah.
us those pointers on how to have those conversations with our kids.
Hmm.
So, in addition to everything that we've shared here, are there other pointers that you want to drive home to our men as the importance of talk to someone? It's okay. It doesn't make you less than.
No, no, and in fact, I think it actually proves that you're very courageous and that you are doing a service to not only yourself but to your community and to those that love you. So again, if you can find the time to really take care of yourself, therapy is not the only way to do it, right? But it's a wonderful way to be able to kind of put everything out on the table, where you won't be judged, where you can, again, unpack all of the issues that you might be going through or non issues, right? But it'll help you to be able to understand where you are in life and where you would like to go. And I know right now it sounds maybe hopeful and encouraging, but that's what it's meant to be. That's
Yeah.
what it's meant to be. Um, Again, men are oftentimes told, there's no time for crying. You know, there's no time for talking and feeling sad for yourself or feeling sorry for yourself. That's not what therapy is about. It's really just about empowering yourself and giving love back to yourself, because Lord knows you all endure a lot. And I'm talking specifically to our men. So if I can encourage even one person out there to, um, give back to yourself in this way, I feel like I did my job.
I
So,
agree, and especially even with the pan well, we have a little play game. I know the we call it a pandemonium, but that's
right.
just a side joke with my daughter and I. But with the
Hmm.
pandemic, I know it's heightened the stress, not just with men, just with everyone, society on a whole. And even though
Right.
everyone is talking about it, not everyone is dealing with it.
Right.
What are some tips
Exactly.
you can just give to our men with regards to, because they probably lost their jobs, they lost their businesses, they have to spend more time with their significant others, with their children, and not that that's a bad thing, but when you add things on top of things on top of things,
That's right.
we don't always know how to deal with that, and we need a outlet, and we
Right.
unfortunately it's caused domestic violence to increase on both ways. I'm not
That's
just saying
right.
the men only, but it's caused
Right.
the increase of domestic violence, and hysteria. Help us,
Hmm.
give us some pointers to deal with the
So,
pandemic
es-
and stress.
especially during this time of, like you were saying, pandemonium, I think that's actually a perfect description of what it is that we've been going through. Um, and then I know I've been sort of harping on it this whole time that we've been talking, but finding a way to incorporate some self-care into your daily routine. So even if it's 3 minutes of deep breathing in the morning, it is 10 minutes of you saying affirmations, positive affirmations to yourself, and in the evening, maybe finding time to engage in meditation. And or if that's not your thing, maybe stretching or yoga. If that's not your thing, well then maybe journaling. If that's not your thing, well then maybe reading. But somehow to feed your mind, and to allow your mind to really again continue to grow and to focus on you as well. Because a lot of times we're focused on either our children, or we might be taking care of other people around the homes. And like you were saying, in addition to um, living with our partners and things of that nature, it gets really um, overwhelming.
Yes.
So if you could just find time for yourself to steal away just a little bit of time to where you could have alone time. Again, it could be 3 minutes, 5 minute intervals, but it's a start. And then maybe you could start building on that, and coming up with a healthy sleep routine, coming up with a healthy exercise routine, coming up with a healthy prayer and meditation routine. And then you can start incorporating all of those things into your life. And then maybe once you do that, you can encourage your family to do it as well. Right. And so it's just a gift that keeps on giving.
Yes.
If you really take care of yourself, really, that's the thought. So,
And you're right. It is a gift that keeps on giving, because once everyone else seeing the results of you doing whatever, it becomes a magnet, and it's like, I want to do
right.
that too. And it could be a
That's right.
family effort, a healthy family, just like a family that prays together, stays together, a family that
Exactly.
meditates, exercises, pauses, do daily affirmations together.
That's
it,
right.
it takes the body, it makes the body go longer,
That's
and it's
right.
important. We truly have to take that stigma and taboo away from taking care of your mental health, because
Right.
without our minds, where are we? Your
Exactly.
body can be going well, but then you lose your mind because of whatever, then
Right.
what?
Right. And again, stress, again, whether you have, past traumas or not, stress alone is a killer, right? And so we want to just make sure that we're taking care of ourselves just as we move through life, because it can be a very stressful event, this thing called life in general.
Yes. And as we're getting ready to wrap up here, let's talk about Thanksgiving. Ooh, Thanksgiving is
Hmm.
right around the corner. We know that we have the fixins and then some. And we have those
Hmm.
beautiful family members and friends we don't always want to have those engagement with. And Dr. Walker, I'm here putting her on the spot now. Give us pointers how to deal with those conversations we don't want to deal with at the at the
You
dinner
know,
table.
and that is something that you'd be surprised I talk about quite a bit. The one thing that I will say is anticipate, honestly, if you have understanding that a family member might have a particular personality, maybe this family member is particularly aggressive. Go in with that understanding, right? But have a short script to say in response and allow yourself to just work through that. And hopefully, it will be an uneventful time if you can just keep it short and sweet. But anticipate what the interaction might be, sort of have a response, and then slowly exit.
Yes, because the main focus of Thanksgiving is being thankful and not being
Exactly.
stressed or have that anxiety of, oh, I don't want to deal with, you know?
That's right.
Yeah,
That's right.
prepare that script. I like that. I'm going to take note of that. Take that
That's
script
right.
and prepare because at the end of the day, it's your mental state, your peace is what's
That's right.
important, right?
Right. Right. Absolutely.
Thank you so much. This
It
has
really
been
was a
such a
pleasure.
wonderful conversation, and I am so looking forward to learning more about your research and what you do and the fact that you're at the university. I mean, that in itself is wonderful that you're
Hmm.
imparting not only the knowledge, the way of life, the importance of self-help, the importance of therapy to our students at on the university level. I am glad that even in our small community, you have a great clientele full of men. That when you said that did my heart
True.
so glad. I mean, I was like, yes,
That's something I'm very proud of,
yo,
actually. Yes.
jackpot.
Yes.
So thank you so much. So, do you have any closing remarks for our audience, Dr. Walker?
Again, just in this season of Thanksgiving, if we can all just continue to practice our gratitude, let gratitude be the attitude, it really helps to make an impact on your mood. And again, thank you for inviting me to be a guest on your talk show. This was wonderful. It really, really was.
Thank you so much for saying yes. I so appreciate our conversation. I myself just want to come in and sit in your office just because
You are welcome anytime, anytime. Yes.
and I just blessings to you and your family, not just for Thanksgiving, but continuously. And our listening audience, be good to yourself. Be good to yourself. Take the tips that Dr. Walker has imparted today and share them with our mates. We share them with our men, share them with our fathers, our brothers, our uncles, because we need to have a society filled with whole men. And it's okay, men. It's okay to say that you need help. No one is judging. And if you think that person is judging, there's a party of persons that aren't and that
That's
are
right.
here and willing to help and assist. Make a phone call. Call Mind Body Psychology. What is your phone number, Dr. Walker?
It is 715-6463. 715 mind.
Call 715 Mind. We need a full, healthy mind. And sometimes when those talks come into your head, we need to not mind our minds. We need to sit down with a therapist, a professional if we have to. Yes, even though we're going to pray about it, God has ordained and blessed the psychologist and the psychiatrist to assist us with getting to where we are to where we need to be. No more taboo, no more stigma. We're building a community of whole individuals. Thank you so much for joining us and let's talk about you. Continue to celebrate Movember Men, and we're not just having this month for Men's Health Awareness Month. Every day should be Men's Health Awareness Month. Men, take care of yourself. Women, take care of yourself. Have a wonderful Thanksgiving. Don't forget to be thankful. Don't forget your peace. Stay blessed on purpose. Take care. Bye bye, everybody.